Sometimes I really feel the need of communicating these thoughts and ideas. ਅੱਜ ਮੈਂ ਤੁਰਿਆ ਜਾਂਦਾ ਸੀਗਾ ਤੇ ਇੱਕ ਚੀਜ਼ ਮੇਰੇ ਦਿਮਾਗ 'ਚ ਆਈ. By the way, I forgot to mention the date. Today is 19th of March 2026. I'm at, I don't know, I'm at the college street. Eh, you know, you come to these countries, these Western countries where the idea of mental health is a very big deal. And they try to depict it that mental health is something that has to be taken, that needs to be taken care of, right? They come to you, they try to propose the idea, they try to advertise that, uh, speak out. It's okay to talk about your feelings, and the moment you just fucking stopped talking about your feeling, now they're just kind of uncomfortable. Uh, I'm just gonna put it from the reference what exactly I'm talking about when I'm talking about this topic. It's been 3-4 days since my Airbnb application is kind of stuck, and it's been really frustrating, stressful, and anxious 2 weeks. Kind of try to communicate with the Medtronics team. They ended up telling they'll take care of it, but they haven't. All right. So over the period of time, my frustration has just increased. Also, when I communicated the same idea to my diabetes educator, she's a diabetes educator. She's a dietitian and also a certified pump trainer. All right, I just want to put it into perspective. All of these pump trainer, diabetes educator go through extensive period of trainings that actually train them. You know how emotions vary at different levels of blood glucose. When your blood glucose is high, blood glucose goes low. It actually messes up with a lot of hormones in your body. Uh, it's been almost 16 years of living with diabetes now. I can certify with my personal experience. I can say that, yeah, high glucose, low glucose, they all affect your moods marginally. So if any one of you have been ever affected by, ever feel like, oh, you feel like shit because your sugar is high, it's okay. It's very common when your blood glucose go high. There are certain hormones like cortisol that goes up. So eventually it ended up messing up with your emotions and mood. So some of you get frustrated, some of you get sad, some of you get angry. I can understand all of that. However, whenever I talk to people, it doesn't matter if you're a dietitian or endocrinologist, whosoever you are, everybody goes through all these emotions, right? Let me just try to clarify one thing, that nobody will ever understand how, what of the things that a diabetic patient has to go through when uh, when their glucose are high. I recently shifted to pumps, right? Pump therapy, if you know, right? I've been using injections for almost all of my life, but recently I shifted to the pumps. So, because I'm still trying to learn a lot of things, my sugar has been just staying up because of a bad side, because maybe the cannula had a kink. Maybe there was more, again, taking it back to the bad side. His absorption is not so good, and on the fifth day, it gets worse, and the sugar stays up. And I'll tell you, when your sugar stays up for a very long period of time, everybody knows what happens, right? Ketoacidosis, DKA, right? You gotta go test for ketones. You feel nauseous, you feel like vomiting, your head is paining. uh, Yesterday, I literally, because my blood glucose was up for like almost 24 hours, my head was paining for sure. but the feeling was really bad. I just didn't want to be in that place for some reason. And I communicated this with my diabetes educator today, and she was kind of uncomfortable. All right, maybe the way I was communicating wasn't very efficient, but that just brings me back to the main topic that, when you come to these Western countries, they propose the idea of mental health and mental fitness a lot. Like, hey, you gotta go open up, you gotta talk your ideas, and the moment you start talking about your ideas, they're upset, they're uncomfortable, they don't want to hear it, right? Yeah, I feel angry at the specific moment, and if I'm trying to express this, you better listen to it. Right? I see a little bit of hypocrisy over here, and I can understand the idea, of you can open up, you should not be boiling inside, blah blah blah. But the moment you open up, it's just kind of uncomfortable for the person to hear, right? So you also got to understand that the society has a kind of expectation from men. So it's not the same. If a girl's open up, you better shut the fuck up and listen. But if a man's open up, it's not the same, man. You know, it kind of depiction of demasculinization. She kind of loses interest. People loses interest. Society just kind of like don't respect the man who kind of opens up, right? So the best way to deal with it, I don't know what's gonna be the best way, but you're just boiling inside, frustrated. You know, you always can do something about your situation. Uh, yeah, I kind of see like double standards of the society when we actually talk about mental health. That you should go open up. But the real reason is the moment you open up, they cannot listen to you, right? The moment you open up, they can't listen. Yeah. Uh, I don't know how much study has been done on this topic specifically, but I can assure one thing that most of the time, most of the men feel angry, and obviously, it's related to their hormones, right? Obviously, testosterone level and all that. Uh, yeah, girls will never understand, even though they are the biggest supporter of liberalization, feminism, right? Hey, you know what? You should just come out. You should talk about your fucking emotion. And the moment you just start talking, she don't want to listen to it. It's uncomfortable. It's uncomfortable. Doesn't matter, even though it's for the job. I'll tell you, I was feeling so weird. The only hope I had was my diabetes educator. I was like, man, at least I have a doctor. I have a diabetes educator who I can rely on. But she was so uncomfortable. I could just see that, through the phone when I was talking to her, that she was so uncomfortable. Why I was even like telling her that I was so upset and anxious and stressed. And, you know, there were these thoughts about my ADP application and all of these things that were being discussed with her. And I could see that upsetness. I don't know if that's the right word to use, but I could tell she doesn't know what to react. And now she's just pissed. Maybe I need to talk about these subjects on a longer format. I really need to. Uh, but this was something I was feeling today, and I felt like, I should just open up my phone and actually talk about it. That it's not the same for men, bro. So if you're a man, you just cannot open up. You just cannot. Because the moment you open up, they look at you like, what the fuck is wrong with this weirdo? Right? Even though they are the biggest promoter of, hey, men are the one who just boil inside, they never share their emotion. But the thing is, the society has a kind of expectations from you that right? The moment you fucking open up, it's just very unacceptable for them, right? If you look at the girl, all of their life, they are the princesses, right? Most of them are treated like princesses by their father. The moment they turn adults, they get into um, the workplace, because they're women, they get along with a lot of things. You know exactly what I'm talking about. If they make a mistake, no, it's no problem, right? Because she's a female, right? So a lot of things are kind of double standards in society. That's what I've kind of felt. But yeah, society's kind of double standard about it, bro. But if you're a man, and the moment you fucking open your mouth about how you're feeling, as I said, previously, most of the time, men are feeling angry. They are feeling angry, right? And the anger is possibly due to a disrespect. It's always, as a man, disrespect. It's always a disrespect. Whenever a man is boiling inside, he has his all sort of anger. It always stems from, some sort of disrespect that he has to tolerate, either from his peers, friends, people, or people he is associated with. Um, it's always about that. Uh, but I really want to put this out there. I love how these diabetes education team goes out to these webinars and seminars and try to propose the idea of, hey, you know what? They feel differently, so we gotta listen to. No, no, it's really different. Yeah, it just kind of like brings me back to there's a big difference about being practical and theoretical. In theory, yes, they know what to do, but the moment it's a little bit practical, they know they have to deal with it. They kind of back out because it's their instinctual. It's kind of instinctual. Like what the fuck is wrong with this weirdo? Right? Why is he even talking about this shit? So maybe it's just a lesson to myself. Maybe just a lesson to my community, my friends, that if you're a man, just shut the fuck up. Don't need to go talk about your fucking emotions, uh, unless or until it's your best friend and who's a male. 'Cause that's the only person who will actually understand you. If it's any kind of female, I can assure you they can never even fathom, because they're just not meant to. They don't know how you feel. So there's a lot of things that goes on that you might wanna try to understand that. Well, I think that was enough of it. If you wanna go home, make another video. But yeah, stay safe. Take a long breath.